Hello and welcome to my YouTube channel. Special attention, be patient for at least 20 seconds of this video clip, and you will surely find what you are looking for. Alexandru is my name, and in this video clip we will discuss about gaming addiction symptoms, causes, treatment at psychology cabinet *. Everything you want to know about gambling addiction. What is gambling addiction? Gambling addiction, also known as pathological gambling, involves maladaptive patterns of gambling behavior despite associated negative consequences. Gambling disorder is currently the only behavioral addiction included in the Diagnostic and Statistical Manual of Mental Disorders, DSM-5. A compulsive or pathological gambler is someone who cannot resist their urges. The urge to gamble becomes so great that the tension can only be relieved by playing more and more. Gambling is addictive because it stimulates the brain's reward system just like drugs or alcohol. In fact, gambling addiction is the most common addiction worldwide, although its devastating effects are not fully understood. Normal gambling versus pathological or compulsive gambling. For the most part, moderate gambling is socially acceptable behavior. Gambling addiction is a different story altogether. If left untreated, gambling addiction can negatively affect you financially, relationally, or professionally. If we talk about normal or social games, they usually take place with friends or work colleagues. Their duration is limited, losses are insignificant and predetermined. The person has the ability to say stop, which is why their quality of life is not affected. Conversely, if you have developed a gambling addiction, you may feel an uncontrollable urge to buy lottery tickets, to go to casinos, to play slot machines, to bet on various sports activities, to play games of chance online. The difference between normal and pathological gambling is that, in the latter case, you continue to gamble despite the fact that you have faced a variety of negative consequences. How does gambling addiction manifest itself? People often deny that they have a gambling problem. However, the first and most important step is to admit that there is a problem. Some realize this only when the consequences are extremely severe. Do you want to get to that point? Maladaptive play is indicated by 5 or more of the following components. Concern. The person is preoccupied with gambling and has frequent thoughts about gambling experiences, such as planning their next game, or finding ways to get money to gamble with. Tolerance. Similar to drug tolerance, the person must gamble increasing amounts of money to achieve the desired high. Loss of control. The person has made repeated unsuccessful efforts to control, reduce, or stop gambling. Withdrawal. The person is restless or irritable when trying to reduce or stop gambling. Escape. The person plays to escape problems or to relieve a dysphoric mood, feelings of helplessness, guilt, anxiety, depression. Lie. The person lies to other family members, their psychologist, or others to hide the fact that they are still gambling. Illegal activity. The person has committed illegal acts such as forgery, fraud, theft, or embezzlement in order to have money for gambling. Problems in personal life. The person has jeopardized or lost a significant relationship, job, or educational or career opportunities because of gambling. Financial dependence on others. The person relies on others, such as friends or family, to provide them with money to get them out of desperate gambling situations. How do you know if you gamble compulsively or pathologically? Although some people gamble only occasionally, the pathological gambler makes it a habit. As things progress, the player will take more and more risks, leading to serious personal problems, financial ruin, and even worse, criminal acts. You are most likely to have developed a gambling addiction if, in the last 12 months, gambling has caused you significant distress. You preoccupy yourself excessively with gambling. For example, you have persistent thoughts about past gambling experiences, you plan your next game, you think of ways to get money to gamble with. You have difficulty controlling yourself and make considerable, but unsuccessful efforts to stop. Gambling has produced many negative consequences in your life, such as losing your family and job. You lie about gambling. You have financial problems due to gambling. You play increasingly large sums of money. When you win, you tend to bet all your winnings quickly. Games help you when you feel helpless, guilty, anxious, or depressed. You rely on other people's money to solve your financial problems caused by gambling. Gambling addiction. 2. Consequences of gambling addiction. Gambling addiction affects 1–3% of adults of all ages, and is much more common in men. The onset of this problem often occurs in adolescence. However, adults are more vulnerable to this addiction due to their reliance on fixed income and limited ability to recover from gambling losses. Causes of gambling addiction. It is not known exactly what causes gambling addiction. Like many other psychological problems, compulsive gambling is the result of a combination of biological, genetic, psychological, and environmental factors. Although most people who gamble do not develop an addiction to gambling, there are certain risk factors that increase the risk of developing it. Mental health disorders. People who gamble often have problems with substance abuse, personality disorders, depression or anxiety. Compulsive gambling may also be associated with bipolar disorder, obsessive-compulsive disorder, OCD, or attention deficit, hyperactivity disorder, ADHD. Age. Compulsive gambling is more common in younger and middle-aged people. Gambling during childhood or adolescence increases the risk of developing compulsive gambling later in life. Kind. Compulsive gambling is more common in men than women. Influence of family or friends. If your family members or friends have a gambling problem, there is a higher chance that you will develop such problems as well. Medicines used to treat Parkinson's disease and restless legs syndrome. These drugs have a rare side effect that can lead to compulsive behaviors, including gambling. Certain personality characteristics. Highly competitive, impulsive, restless people have a higher risk of compulsive gambling. Distorted thinking. Gambling is an inefficient and unsafe way to acquire money. For someone to become addicted to gambling, their cognitions or thought processes must be distorted to the point where the central truth escapes them. If you have certain risk factors for compulsive gambling, it is advisable to avoid gambling in any form. Get help at even the slightest sign of a pathological gambling problem, and don't let the problems get worse. Your brain responds to gambling the same way an alcoholic's brain responds to a drink. The more you feed your habit, the worse it will become. What does a person without gambling addiction look like? A person who does not experience gambling problems is full of hope and optimism. He knows how to deal much better with the problems and stress he faces. He understands that the happiness he can feel is only in his hands, has good relationships with family, friends and everyone else. His family is happy. He has no financial difficulties or legal problems. He wakes up with a smile on his face. She is grateful for the things that happen to her. If you got here to the end of the video I presented on my YouTube channel, Alexandru, thank you for watching the video. I hope it was useful, and I hope it helped you in some way. If you like this video clip, I would be happy if you like a share and subscribe to this channel. Only good regards, Alexandru YouTube channel creator.